So today we are going in to tell you about all the diseases that you can get. Now, let me ask you something. You, as a young lady or young man, or as a married woman or a married man, or a divorcee, do you think having sexual intercourse is something that you can never do without? Do you think you are supposed to have sexual intercourse every time of your life? Your guess is as good as mine. There's no good bad thing in having sex. Believe you me, it is a very sweet and very, very nice thing to have, especially with somebody that you love. But guess what? Do you think the things that can come out of it, you will be ready for it? This is your favorite doctor in the house, Dr. Tonia of True Health with Dr. Tonia. Yes, that's me. You all are welcome to my life. Welcome, welcome, welcome. Right now, I need you all to click that share button, because guess what? If you are an adult, if you are a big boy or a big girl, you must have had sexual intercourse once or twice or many times in your life, right? So what are we going to do today? We are trying to teach people so that they understand that, look, in as much as you want to have sexual intercourse, you should have it rightly. Don't just go patronizing anybody you see out there, because guess what? What you're seeing outwardly, it is not what is inwardly, because a lot of people are carrying garbages, a lot of garbages of STDs. And it might just be that one time that you go seeking sexual intercourse where you're not supposed to seek sexual intercourse, that will make you regret yourself ever. That 1 minute might be what will make you to have HIV. That 1 minute will make you have some sexually transmitted diseases that could damage a woman's womb. Guys, why would you want something like that to happen to you? So that is why I decided and said, you know what, I have discussed this STDs before, but today I want all of us to pay attention so that we will talk about other types of STDs, because they abound. Okay? So what I need you to understand today is this. I am a Catholic. We believe in abstinence. I don't know what you believe in. I'm not going to force myself into your life. But listen, if you must have sexual intercourse, for me, why don't you have a sexual partner that you trust? Because guess what? Even though you are not having sexual intercourse, the other person might be out there having a lot of people they are sleeping with, whereas you are the only person, she or he is the only person that you have. Meanwhile, she is going around frolicking up and down, and then she will catch that STDs and come and give you innocently. So to me, even when we marry, our husbands and wives that we trust may have had some other things that they are doing that we don't know. Or even there are some women that even encourage their husband to do that. I have patients that have come to me. They will tell me, my husband is disturbing me too much. He should go ahead and do whatever thing they are doing. I need to focus on the children. Listen, my dear followers, it is on you as a married woman or as a married man to make sure you make your wife very, very comfortable when it comes to sexual satisfaction. I mean, if that lady wanted to be born again or want to be a reverend sister, she or he or reverend father or brother that are in the Catholic Church but they decide not to get married, they decide to do that. That doesn't mean that they don't like the life of having to marry. But any woman or man that has decided and said, you know what, I am going to get married. Listen, you as the husband should Make sure you satisfy this woman at any time that she wants it. And you as a woman too, you must satisfy your husband at any time that he wants it too. Because guess what? If you don't do that, he is going to go outside. And it might be that one outside that he has gone out that he's going to get that STD, HIV, and every other thing that could completely ruin your marriage or destroy your life forever. So please, as we are all matured, we should also reason maturely and understand that sex is beautiful, but it is very beautiful when you do it with somebody that you love. You all heard what happened in the internet some days ago when two girls had this man that they connected on the internet. Who heard about that story? And they went to have threesome and never returned. The man died, all of them. Did anybody hear about that story? The people in YouTube, did you hear about that story? People on Instagram, did you hear about that story? It's been buzzing. Maybe you go to your Facebook, go to the search button and say, what is the recent happening in Nigeria about killings with people that you meet on Facebook? So you guys, why am I saying that? For young girls that have taken it upon themselves to stand on the road and hawk themselves and have people that they don't know carry them in their car and jet them into hotels. You don't even know who this person is. That might be the last time you're going to see the surface of this earth. Because guess what? You can meet anybody anywhere and have whatever thing you want to have with the person. But the person could actually decide to buy you there and run away. There was no CCTV that you carried. There was no camera that you carried. And even if you carried your phone, you didn't video it. So you all have to be careful because the world out there is evil. People are so terrible that even when you think you trust the person, even your best friend could be the person that will be planning evil for you. So be that as it may, we are going to dive into different types of sexually transmitted disease. The number one on the list of sexually transmitted diseases, the almighty who? AIDS. HIV AIDS. Okay? This HIV AIDS have really done so badly. And now why I really want to focus on this particular one is why this particular HIV AIDS rampaged and did a lot of havoc was because people or the Caucasians that HIV AIDS came to before it came to us that are in Africa made it, they kind of made it look like it is a taboo, because initially they made it look like it is, though that is the truth. HIV came because of copulation of men and men having anal sex. Okay? Some people also had sexual intercourse with animals and all that. So this is the gist about HIV, right? Now, when it came to Africa, because we are highly religious, a lot of people are homosexuals, a lot are bisexuals, but in Africa, a lot of people hide their identity. So when it came to Africa and everybody saw that it is an illness that has to do with men, having something to do with men, most of the people that were doing that kind of sexual activity, because they don't want their family to chastise them or throw them away, they started hiding themselves. So that's why when anybody have HIV, the whole entire community, even till the point of your parents, are going to deject you, to abandon you, and make you understand that you have done the greatest harm on earth. Meanwhile, STD is as simple as malaria fever. HIV is as simple as any infection or disease that you could have gotten. So what am I trying to say? All I'm just trying to say is that it is because of the demonization of HIV that people felt that, oh, even if I have HIV, they will never open their mouth to say it, so that people will not feel, say, oh, so you had multiple sexual partners. Oh, so you had sex with your fellow man or thereabout. So a lot of people had this disease, never went to take medications, never treated themselves. They were hiding themselves until their CD4 count was as low as ever. Because when your CD4 count is as low as ever, your immunity is not strong to fight these HIV infections. So a lot of people got eliminated because they had this HIV AIDS. Okay? Now, one thing I can tell you is when you have HIV, you are going to have a lot of opportunistic infections. You're going to have Kaposi sarcoma. You're going to have lymphoma and all these myriads of illnesses. Why? Because your immunity is very low. So anything that comes in, you are going to get it, and that will be it for you. Okay? Now, another very, very important STD we are going to talk about is chlamydia. Chlamydia infection is another sexually transmitted disease, all right? And in this chlamydia infection, you have what we call urethritis, you have cervicitis, that is, the cervix is inflamed and painful. You have epididymitis, okay, and conjunctival reaction on your eyes. You're going to have a lot of discharges and reactions and pelvic inflammatory diseases. So when you have chlamydia, it is very, very important you go to the hospital, seek medical treatment on time so that everything will be treated and you'll be home and dry. The next type of pelvic inflammatory disease that we are going to also discuss today is condylomata accuminata. That's a very big name, right? But it is a sort of genital wart. You know what wart is? You know, it's like a kind of cauliflower that you will look and you see it on your genital areas. All right, it's just like a kind of growth. All those are as a result of sexually transmitted diseases. Okay, now there is also other things that can be infected when you have, sexual partner with somebody that already have that disease. Another thing is called herpes genitalis. All right. So in this particular one, you have painful penile. Your penis is going to be very, very painful. Your vulva for the woman will be very, very painful, and you will have cervical pain. All right, and sometimes people will have bilateral inguinal lymphadenopathy. What that means is that your lymph node on your both sides of your thigh, okay, upper part of your thigh, you have the lymph node inflamed because of this infection called herpes genitalis. All right. Now, when you have all those things, you could actually develop fever, you can have headache, you can have myalgia. So when you have all these things, you cannot just sit down and then go take paracetamol or just go and take any antibiotics, because antibiotics, if we in Africa, we abuse antibiotics a lot. That is why when you have an infection and then this antibiotics is what is sensitive to the organism, that is going to kill the organism, and you take those medications, it will not kill it again. Why? Because you have already taken a lot of antibiotics and you have made your body to be resistant to this particular antibiotics. So it is very, very important when you're noticing that you're having lymph node, you're having fever, you're having genital wart, or all the things that I've mentioned above, you must go to the hospital and seek medical treatment. Okay? Another very, very important one. In fact, let me tell you one story. When I was a child, I should be maybe like 10 years old, thereabout, I was sent on errand on a glaring afternoon. I wasn't even in medical school then. As I was walking around along the road, this is a busy road, so it's not as if this man was hiding. This man brought out his odogwu and was touching it. I was even afraid. I had to run for my dear life. But now I come to realize, because even when I sat down and I saw patients having this gonorrhea, it's now stuck on my mind that, oh, this is what this man was having, and that's why he couldn't even help it than to bring it on the road to, think he is going to be touching it and massaging it. All right. Now, in gonorrhea, you have urethritis, you have cervicitis, you have PID, you have prostatitis. All right. And epididymitis or arthritis of the male genital canal organ. All right. Now, sometimes you have creamy, very purulent discharge from the penis. It will be like whitish discharge coming out from your penile organ. All right. And that was what the man was, what was coming out from his penile organ at the time that I had to run for my life, because I wasn't even sure whether he want to rape me or whatever thing he's doing. You understand? And guess what? When men have gonorrhea, for it to come out in such a way that you're going to see all those discharge coming out, that means it has stayed in that man for a long time. But when this man meets a woman, he is carrying this gonorrhea organism inside him, his organ, right? It will not show. He will not even understand that he might not even know. He has had one night stand with one of the oloshos or all the call girls that he put on the road. He didn't know that they've given him gonorrhea. He goes back home and sleep with his wife, have sexual intercourse with his wife. The wife is going to start having presentations of gonorrhea earlier than him. And most men that are very, very bad will not say, oh, you are going out somewhere, you have given me gonorrhea. Meanwhile, they are the person that gave the woman gonorrhea. Do you know why the woman have this gonorrhea, come earlier before that of a man? Because our urethra is very short. Okay? So when this gonorrhea infection gets to a woman, it manifests earlier than that of a man that will be habiting it. That is even why in cancer of the cervix, okay, or cervical cancer, a man will carry that on his penile organ, have sexual intercourse for years. He doesn't even know he had any infection. And when he infects the wife will end up having cervical cancer. Can you all imagine what I will tell you all now? Some of you may know. Do you remember our former military president, Babangida? Anybody that knows Babangida, type it on the comment section. Do you know Babangida? General Ibrahim Babangida. Did you all remember his beautiful wife? If you know Babangida, if you're from Nigeria, please type on the comment section and tell me, do you know who Ibrahim Babangida is? Do you all remember that his very beautiful young lady? Okay, let's leave Babangida alone. Do you people remember Dora Akunyili? The dogged Dora Akunyili that was is it NAFDAC? Yes, NAFDAC chairman, chairlady. Do you all remember Dora? She's late now. What's by them? These two people had all the money, isn't it? But they had cervical cancer. They didn't know. Either their husbands, or less maybe they're having extramarital affair. I don't know. But most likely it should be their husband, because that... Okay, somebody said... I don't know what you wrote. Fractured chairperson. Oh, NAFDAC. Yes, I've already said it. Good. NAFDAC chairlady. They had this infection because they didn't take the simple vaccine that will prevent, cover them from getting cervical cancer. Can you imagine the president's wife, his number one wife? I don't know how many wives Babangida has, but that is the wife he showed off and showcased for years. If anybody remember the name of Babangida's wife, can you type it on the comment section? I can't remember her name again. They all died of cervical cancer. So these are the things that you can get when you have sexual escapades or sexual enjoyments, probably with some call girl. Or even the girl will be looking so good, you don't even know what is in the girl. Or the man will be looking so good, you decide and say, okay, let me go and have a one night stand away from your husband. And that will be it. Okay? So there's another thing that you can get, which is also a sexually transmitted disease. This one is called granuloma inguinale. All right? This one is very, very painless. But you are going to have very beefy, you know how beef is, right? Beefy red ulcer that bleeds rapidly on contact. That means whenever you have sexual intercourse with a woman or a man, is going to start bleeding. It's going to start having, blood come out from either the woman or the man. All right? Now, another thing you can also have is, but in US, this particular one is not here. It's more in the, other parts of the world. All right? Hepatitis. I'm sure some people don't even know that hepatitis, you also get it from sexually transmission. It's transmitted sexually. So yes, some of them can be transmitted by blood, when you also take blood transfusion, or there's somebody that already have a bleeding somewhere and your blood touched the person, right? Okay, at what age do you take the vaccine to prevent cervical cancer? Okay, let me even say it this way. As far as a lady is sexually active, there are some children that at 12, they are already sexually active. It is not the right thing to do, but you can't even control, you don't even, the monkey will say, I will only vouch for the child that I'm carrying on my tummy. The one I'm carrying at the back, I will not vouch for. There are some children that either have been molested or they just started having sexual intercourse on time. Okay? So every girl child that has had sexual intercourse before should take the vaccine. But normally, it should be when you are about 18 or above. If you haven't had sexual intercourse and you're 25 years old, it's okay that you've not taken that vaccine. All right? So it is very, very important you are there. Understand that there are certain illnesses, because that is even so sad. I have talked about cervical cancer before in some of my previous videos. Because guess what? If actually there is a preventive thing to take that will make you not to have this cervical cancer, and believe you me, this is the only cancer that have a vaccine. Breast cancer doesn't have a vaccine. Every other cancer of the colon, cancer of the esophagus, all of these don't have any vaccine. Cervical cancer is the only cancer that you take HPV vaccine, human papilloma virus, right? It is the organism that causes this cervical cancer. But if you take your vaccine on time, you will not have any vaccine. But guess what? Unfortunately, this particular cervical cancer is the second after breast cancer on women. The second that kills women or by women is this cervical cancer. So if we all as individuals would do the right thing, take our vaccines and make sure that we do the right thing. Babangida's wife would have been Miriam Babangida. Yes, somebody in YouTube told me the name now. Her name is Miriam Babangida. You all remember Miriam Babangida? People in Nigeria. She was so beautiful, black, ebony black, and so elegant. That's the first wife of our then military presidents. Babangida is still alive, but she is the person probably definitely that would have given this infection to the wife, unless the wife have some extramarital affairs. Who knows? All these people, you don't even know what they are doing, right? If Obasanjo's wife will go do liposuction, Who is she doing the liposuction for? And there were stories flying then. I don't know. I'm not in government, so I don't know what they are doing. So it could be the infection was given to Miriam Babangida by the husband, or it might be that she has something else that she was doing. I don't know. It's left for them. All right. Now, there's another infection. There's another infection that is called lymphogranuloma. All right. This infection is infection that affect the lymphatics. Okay. It is very, very painless. You will not feel the pain, but it has some genital ulcers. So that means you're going to have some ulcers in your genitalias, but it will be painless. So when you get all these things that I mentioned today, make sure, I've not even gotten to the question time. So you guys don't worry, because somebody must have to go with my giveaway today. It is very, very important that somebody must go home with my giveaway. All right. Now, there's also another thing that is called primary syphilis. Okay, first of all, it is called syphilis, right? We have primary syphilis, we have secondary syphilis, and we have tertiary syphilis. Syphilis is another sexually transmitted disease. All right? You can have fever, you can have diffuse lymphadenopathy, there will be skin rashes, there will be condylomata. There are so many things that you are going to feel in your body when this syphilis is in the secondary stage, right? Whereas when it is in the primary stage, it can just be a painless chancre with some lymph node that are in your regional areas, your inguinal lymph node and all that, okay? But in secondary syphilis, you will not have a very serious, manifestations that you have your gomas, you have your tepis dorsalis, and you have generalized paresthesis all over your body, or otitis. So all these things are the things that you're going to feel in secondary syphilis. That's why any woman that have gonorrhea or syphilis that is pregnant, it is a very, very serious situation, because the baby in utero can get this infection. That's why some of them, when you give birth to these babies, you are going to see some facial manifestations that they are going to have, because they have been infected. Even if they are not infected in utero, when the baby is coming out through the vagina us, right, during the birthing of the baby can catch it during the delivery too. So it is very, very important. When you feel you have a discharge that is abnormal, remember, for a woman, vaginal discharge is normal on a woman. But when you are not seeing it, that it is getting thicker or colorless or fishy odor, or excessively, cheesy, okay? Like a cheese, the way when you break a cheese, right? That is also very important. You go see your doctor. When your doctor gives you a treatment, the doctor is going to tell you to bring your sexual partner, and your sexual partner is going to also be given treatment. You know why? So that you will not be reinfected again. So you're being treated, your sexual partner is being treated, so that when all the treatment is gone, two of you are home and dry, and you will be doing very, very well. Finally, the next sexually transmitted disease is trichomoniasis. Okay, this is a vaginitis, which is strawberry in, how strawberries are, right? Good. Your cervix will be like that of a strawberry. You know how, the red strawberry, right? And when you put it on a wet prep in the laboratory, you're going to see it that this is completely a sexually transmitted disease called trichomoniasis. Okay, finally, this would have been the first one I would have mentioned, but because I'm discussing very serious sexually transmitted diseases. That's why I didn't mention that. Candidiasis, you can get candidiasis with sexual transmission too. So whatever infection that you get, please ensure you go to the hospital, talk to your significant other, so that he will also understand that there's also an infection going. Because guess what? It's the women that usually feel these infections earlier than a man, so that you will take your treatment on time, get yourself treated completely, and you continue your normal daily life. Now, whenever I wrap my discussion, I'm going to relate it to what your family would do. When you are having sexually transmitted disease, this is not the time for a husband to start abusing the wife, or the wife abusing the husband. You are a useless man. You have given me STD. You have given me HIV. It has happened, and it has happened. You people have to be together, encourage yourselves. Don't say, oh, because I have HIV, I'm going to now go about giving it to people. No, that is not the right thing to do. What the right thing to do is to be together and believe in yourselves and say, look, we are going to do this. Because guess what? Here, a lot of people have HIV, but you will never know the difference between the person that have HIV and the person that doesn't have HIV. Because why? They are taking their medications, whereas people in Africa are dying. The people here that brought the HIV to us have already understood that, look, this treatment is just like somebody that have diabetes or hypertension that is taking medications every day and nothing will happen. So please, guys, if you have HIV or STD of any sort, that is not the time for you to start the blame game. It has happened. It has happened. What you now face is, how do we mitigate this? How do we treat ourselves, get better, and then run our family and take care of our children? Okay? So I am going to stop here. But we have now come to my favorite part of my talk show. So you guys that have been watching, that has been paying attention, this is your time to get a giveaway. You heard me right. If you go to my previous videos, you will see a lot of people that won giveaways. Look, I am supposed to be paid, right, for teaching you all this thing. But I took it upon myself, because a lot of people don't even know when they have infections, when they are supposed to go to hospital, when they are supposed not to go to hospital. I decided and said, you know what? Since Facebook is global, the whole entire world, I have a lot of fans from different continents. It is good I used my platform to discuss with people, so that all the things that they are feeling, that they don't even know that they are feeling before, they can understand what it is. I have talked about so many things, so many things. Where am I going to start? If you want to know the topics that I've talked about, go to my Facebook page, Antonia Okoro, or my YouTube page, True Health with Dr. Tonia, or my Instagram, or my Snapchat, or my TikTok. I am all over the place discussing what you need to know to better your life. So now let us keep that aside. My simple question today, if you are listening and you heard everything that I wrote, and you have shared, if you have not shared this life, there's no point answering the question, because my management is at the other side checking who have shared my life. Number one question is, you would think I'm going to give you very strong questions. No. All I'm just trying to do is for me to be sure that you understood everything that I did today. My number one question is, what is the topic we discussed today? What topic did we discuss? Type it now. People on YouTube, type the question I am asking and the answer right now on the comment section. What is the topic of today? What topic did we discuss today? And I talked about, that's number one question. Number two question is, I discussed a lot of STDs today. Give me just 5. Don't give me the side effects or symptoms or, whatever, but give me 5 diseases that can be transmitted sexually, the things that I mentioned in this life now. The time starts now. These are the two only questions I'm going to ask today. If you type the answer and get this answer correct, you stand a chance. Right this minute, I will transfer your money into your account. Okay, somebody said our topic today is about sexually transmitted disease. Yay, please, can you all send him a thumbs up? That's correct. He answered it. You are going to answer the two questions. Yes. You said HIV, that's number one. I said 5. You're going to give me 5 diseases that I mentioned today. Yes, go ahead, because you are getting it and you stand a chance to get. Go ahead, go ahead, go ahead, go ahead. That's number 2. Number 3, syphilis. That's correct. So you were paying attention. That is very, very correct. Yep. It's remaining 2. Gonorrhea. That's correct. Guys, don't you have your emojis? Can you pop up the emojis? Somebody is answering this question. So you have the final one, the final chlamydia. Yay! So congratulations to official G underscore official underscore G underscore O underscore D1. You have won your giveaway. Can you send me your account details on my, if you're comfortable? I don't know about it. I'm not going to be taking any responsibility. For me, I don't usually allow people to send their bank details on the chat here. Send it privately to me right now, and I'm going to credit your account, and you're going to confirm that, yeah, hooray. Please, can you send the emojis, like congratulatory emojis? Can you send it? It's on Instagram. Can you send it? You really did well. I'm so proud of you that you got this correct. Now the next thing is send your account number to my Instagram messenger or my WhatsApp. It's on my page. If you know my WhatsApp, send it now so that you get your credit. I'm about to round up, and we've come to the end of today. Now listen, if at any time you see this video, let's say that you haven't answered this question, or you came in towards the end of this live, you can go back and watch this video. I am going to credit 10 people this giveaway. Okay, all you need to do, answer it on the comment section and send me your answer. Okay, when you send me your answer, you know what I'm talking about. I cannot say it. This is social media. If you you send it in WhatsApp. Okay, let me see. Chido, you don't know your phone. Come with it. Hmm? Okay, so I'm trying to official underscore G underscore O underscore G D1. I'm trying to send the money. When I send this money, you need to confirm online so that people will know that I am not doing any play. We are not playing in here. We are live and we do our thing the way we are supposed to do it. You know, all this thing I'm doing, I'm not doing it because I have so much money. No, I'm doing it because I need, and if people can actually get 2 or 3 medical related topics every week, I have talked about so many things. I've talked about grief. Whatever I see on internet, I use it to give you some medical training and teachings. I have talked about postpartum depression, postpartum. I've talked about hypertension in pregnancy. So many things. I've talked about things that people do to harm themselves, okay, by going to the traditional bone setters or babalawos and all that, instead of going to hospital. Then by the time they will get to hospital, things had gone so bad. So official underscore G underscore O underscore D, I'm still trying to transfer the money. I'm going to be talking. Whenever you get that transfer, you let me know. So what am I trying to say? As a doctor, I have seen it all, to the point that there are sometimes, when I finish seeing a patient and the patient leave my table, I cry my eyes out because of, preventable situation or something that just need just a little bit of treatment. Can you imagine things like hypertension? You have hypertension or diabetes. That is very simple. You are supposed to be taking your medication, and then a man of God would tell you, or because I call them man of God in quotes, okay, and tell you you are not supposed to take any medication. Just take this handkerchief. I have blessed it. Or take this medication. They will mix. What do they call it? They say is blessed water, and they deceive their gullible followers, because they are not church members, they are followers. They deceive them, and these people will end up taking these unfound miracles according to them. In fact, there was one video I saw. I asked the person, I saw it in somebody's, where I'm not going to mention his name, but you all know him. Maybe you've seen this video. It was trending, but I couldn't download it. I told somebody to send me that picture because I wanted to post it in my page, where he was telling his followers, this is a big GO. His name starts with A. He was telling his followers that somebody had breast cancer. Guys, breast cancer. And a man of God is telling people that, do you know, I brought the handkerchief that I have blessed and gave it to him, and the breast cancer disappeared. What a nonsense. What kind of deceit are you doing? Meanwhile, when their wife just complain of ear pain or even an itch, a rash, they will go to the best of hospitals. Okay, I'm going to allow you. Come in if you want to be. Come in. Maybe you have something to tell us. Official OD, come in.
Yeah.
Okay. How are you doing? So do you have something to tell us?
Yes.
Okay.
This topic is very, very, very important, and we think that it's just the women that have this thing, but from what you said now, it means that the men carry it more, but our own does not show quickly.
That's correct.
So
That's correct.
my advice to my own, especially the men, is that never be too far from your medical practitioner, so you can always check, always know, always be informed. And guys, we find it hard to go to therapy to say what's on our mind, but we can say it to ourselves.
I know.
So never be ashamed to speak out to your friends, to your guys, and who knows, amongst them there might be someone that has the idea that will help you live a better and cleaner life. So,
and as a matter of fact, like what you said now, some people who have these infections, they know they have this infection, right? They will be in denial, and they will start either taking medications by them, on themselves. Meanwhile, these infections are supposed to go to they are supposed to take a sample of your semen. For the woman, they will take a high vaginal swab and take it to the microbiology or laboratory and do some tests. Instead of doing the right thing, they will just go and take antibiotics. And that antibiotics might not even be the one that is sensitive. Hold on, you continue. It might not be the one that is sensitive to the organism that is causing these sexually transmitted infections.
yes. Another problem is Google.
You are 100%. I agree with you in that one. Some patients will come to me, they would have made their own diagnosis. Meanwhile, it is 100% off from what they have. They will say, yes, I read it in Google, and they are proud. They will even bring it out to you and say, look at it, I read it in Google. That's what my diagnosis is. And they will start self-medicating.
That's the problem.
Yeah.
Problem is Google. Google
Yeah.
is a very big problem, because people will say Google is always correct, which that's not true. Google is not always correct. Google have an idea, but they are not always correct.
That's correct.
It still boils down to having a health physician that knows their stuff, and you are also free to confide in, to tell them, okay, this is what I'm feeling on, without any shame or embarrassment. Tell them, okay, this is what I'm feeling on, this is how it is going on. What do you suggest I do?
Mm-hmm.
I think that's the best way to go.
I agree with you. That is a very good point. That is a very good point. Go ahead. I'm listening to you.
Hear me?
Yes.
Can you hear me?
I'm hearing you. I am hearing you. I'm hearing you. It's like is it your network or my network? Guys, are you guys hearing me? I'm talking. Do you guys hear what I'm saying? Hello? I think it's your network. Guys, did you hear what I said? So who else want to come online to tell us something? Who else want to come online to tell us what they think about this topic we are discussing? If you want me to bring you online, Rama, Kid, you, Monico, Nomads, D. Hartley, Junior, just let me know if you guys want me to bring you online so that you tell me about your own story. Okay? I would like to hear from you all what your experience is when it comes to. Let me see if I can bring in this person. If you come up, tell me about it. It must not be that you've had sexually transmitted disease. We are just discussing what is limiting people from going to hospital. Okay? A lot of people are having medical issues. Instead of going to the hospital, they will end up just staying on their own. And then the infection will have been very, very bad. That's the time they will not go to the hospital. What will a doctor do if already your gonorrhea have gone to the very, very bad situation where nobody can help you? Or maybe you have syphilis, it's already on tertiary syphilis. Meanwhile, when it was in primary syphilis, the doctor would do everything humanly possible to get this thing sorted out. Okay? All right? So I don't know whether the network is from my side or from your side, but I guess I have a very good network. So what are we saying today? Identify the signs and symptoms that you have on time and seek medical treatments from the right sources. If a medical doctor had gone to medical school for 6 years, excluding strikes, you could understand that definitely they know what they are doing, isn't it? How will you now go and trust somebody that haven't even gone to secondary school, talk less of going to university? Somebody will have bone fracture. Instead of going to an orthopedic doctor, you go to a homeopathic person and the person would just destroy your bones and not even only cause malunion or non-union, the person will make you have a very severe infection that will lead to gangrene, and then you will have amputation. All right? So guys, please, it is very, 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 very important. We all know when to say, you know what, I am going to see the doctor. Okay? It is very, very important we do that and get ourselves treated on time. Because guess what? If you don't get that treatment that you deserve, it may end up, because we are talking about, I didn't even tell you all the signs and symptoms, complications of these sexually transmitted diseases that you may likely face the whole entire life. Imagine having a child and the child will be having problem with seeing because of gonorrheal infection. Aren't you going to continue blaming yourself for causing something like that to your child? What about your woman? You give her that infection, and the woman will end up having infertility problem, because these infections must have gone block her womb, or cause a lot of damages that she won't be able to get pregnant for you. Meanwhile, this is treatment that you would have taken at the beginning of this sexually transmitted diseases. If you cannot abstain, the gold standard of all this infection is abstinence. Zip up. Wait until you get married. And then when you get married, you stick to your spouse. Do not frolic and say, oh, let me just have this one night stand, because that one night stand might be the thing that will cause you untold harm and difficulties in your marriage. Okay? So, official OD, have you received the money? So, that is so nice that we have completely discussed sexually transmitted disease. We have talked about the different types of sexually transmitted disease, such as chancroid, condylomata accumulata, chlamydia, HIV/AIDS, gonorrhea, syphilis, lymphadenoma, granuloma inguinale, hepatitis, syphilis, primary syphilis, and tertiary syphilis, trichomoniasis. All this we discussed today. So, and we are lucky. One person that answered the question on live won the giveaway. So we are waiting for him, because I have sent the money. I want him to confirm that he has received the money. Later on today, we are going to post the transaction that came in, so that you all will see that I am not joking. Official _G_O_D1. Have you received this money? Have you received the money? Please confirm for us that you have received your money. Okay? Confirm. All right, so um I think we are going to be rounding up now. If you have topics or illnesses that you have had before, diseases that you have faced before, and you think you need me to talk about it, throw more light on it so that you will also understand well, just send me a back channel, give me the topics so that we will do justice to it. The next time where I'm going to come in, there's a very sad thing that happened on the internet. I cried my eyes out. I didn't want to do anything because I didn't want to do as if um I am, you know, keen into that tragedy to make people um to make money off of it. You all must have heard when Junior Pope died, right? Junior Pope is one of the A-list young bubbling guy that went to do his shooting, and unfortunately his life was cut short due to drowning. So I would have discussed that topic, but I cried and cried. In fact, I was depressed. But now that I am stronger and I have moved on, I need to use that to teach a lot of people what drowning means. What are you going to do? From Junior Pope issue, there was nothing anybody could have actually do because he was not wearing any um um vest that would make him to float, right? And he was immersed in that water for a long time. Even all those balls that they say, oh, his hand moved and that. When I learned how long he stayed in that water before they were able to get him out of that water, I knew he was already dead before they brought him out from that water. As a doctor, I was a young doctor doing my youth service. If you guys stay in Lagos, if you know military hospital, not the one for army, Naval Medical Center, it is near the Bar Beach. A young doctor, yes, they have taught us that, but I've never seen drowning or near drowning. That was the first time I heard about what is called near drowning. Okay? And I had seen the last patients, gone to the doctor's room to lie down, and there they came running for a doctor to resuscitate this patient. When I came in, believe you me, it was God that used me to resuscitate that young chap. There's this school of oceanography that is near Bar Beach, right? So these boys will go near the Bar Beach and be playing ball. And when they play ball and get tired, they swim. All right. This boy didn't know how to swim, or maybe he knows how to swim, but the wave carried him. But luckily for him, I don't even know how the wave was able to bring him out, and they rushed after him. The good thing they did was they did a CPR. He was not waking up, and they grabbed him because